Unit X Training and Doping in Sports. Principles of sports training. Training load, overload. Adaptation and recovery. Concept of doping and its disadvantages. Training is the process of preparing human resources for performing a particular task or activity. Sports performance. Training simply is a type of training that is designed to improve the sportsperson's fitness level and ability to perform in a given sport. It includes corrective and restorative exercises, strength training, conditioning, and cardiovascular training, sport-specific techniques and drills, periodization, nutritional advice, mental and psychological training by a qualified trainer. Concept of training. Training for achieving something for competition is not a new idea. With the passage of time, more time and efforts are being devoted to training of preparation for competitions, with the invention of new techniques every now and then in the field of athletics. Weight training methods has shown very encouraging results. Training for any game or event has become very technical, and a scientific approach is needed to get the desired results. Sports training is the preparation of an athlete on scientific-based principles in sequential manner to attain optimum performance in their desired competition. Principles of sports training. Principle of active involvement. Principle of continuity. Principle of progressive load. Principle of overload. Principle of individual differences. Principle of warming up and cooling down. Principle of variety. Principle of specificity. Principle of journal and specification preparation. Principle of cyclist. Principle of overload. Principle of overload, load, in sports. Training is known as the demand that can be physical, physiological, or psychological, put on the body to enhance the performance of the individual. The key point to note, while planning a training session, is the load should be greater than the normal load to aid adaptation process and thus facilitate the performance enhancement. Principle of progression of load. Principle of progression of load. As we discussed above, training load must be greater than the normal load. This principle testifies that training load must be increased gradually in order to avoid any unwanted tension on the muscles of the individual by increasing the load slowly and in accordance with the capabilities of the sports person. Principle of rest and recovery. Principle of rest and recovery. It is evident that during rest, the body restores itself and become better and stronger than before. Both short periods, like hours between multiple sessions, and longer periods, like days or weeks to recover from a long season, are required to ensure that the athlete does not suffer from exhaustion or an overuse injury. Therefore, a training plan must be designed in such a manner that proper rest recovery can take place in between the training sessions. Meaning of doping. Doping may be defined as the use of chemical substances foreign to the body to improve athletic performance. Doping is the use of substances or the employment for improving the performance. Concept and classification of doping. Doping can be classified into two major categories. 1. Performance-enhancing substances. These are the drugs or medicines that can be used to enhance athletic performance. Some of the examples of performance-enhancing substances are anabolic steroids, stimulants, narcotics, etc. 2. Physical methods. These are the techniques used by athletes to increase the performance by unfair means. The same thoughts include blood doping, gene doping, and chemical and physical manipulation performance-enhancing drugs. Performance-enhancing drugs can be classification into the following types. Stimulants, narcotic analgesics, anabolic agents, diuretics, beta blockers. Stimulants. Stimulants are drugs which increase alertness and reduce fatigue and increase competitiveness and hostility. They are banned because they can produce a psychological and physical stimulus which may improve athletic performance. Narcotic analgesics. They are powerful analgesics and are mainly used for management of severe pain. They produce a sensation of euphoria or psychological stimulation, a false feeling of invincibility and illusions of athletic prowess beyond the athlete's inherent ability. Anabolic agents. They are synthetic chemicals designed to have effects similar to a natural steroid produced in the body, the hormones testosterone. Natural testosterone provides anabolic and androgenic, masculinizing effect misused in sports to increase muscle strength and bulk and to promote aggressiveness and as a result increase athletic performance. Diuretics. Diuretics have important therapeutic indication for the removal of excess body fluids from the tissue in certain pathological condition and for management of high blood pressure. Diuretics are sometimes misused by competitors for two main reasons. To reduce weight quickly in sports where weight categories are involved. To reduce the concentration of drugs by diluting the urine. Beta blockers. These are drugs commonly used for heart disease to lower blood pressure and decrease the heart rate. They may also be used in the treatment of migraines and to control tremors. In sports such as shooting or archery where a steady arm or trigger finger is important, beta blockers might be used to slow the heart rate and steady the nerves. Prohibited substances and methods. The International Olympic Committee and the U.S. Olympic Committee are among 625 sports organizations worldwide that have adopted the World Anti-Doping Agency (WADA) code, banning many performance-enhancing substances and methods. Each sports organization that adopts the code is also responsible for enforcing it through drug testing and non-compliance penalties. Name of the prohibited substances and methods are given below. 1. Increased heart rate and blood pressure. 2. Sexual dysfunction. 3. Features like male and females. 4. Physical and mental weakness. 5. Complications like stroke, cardiac problems, and even death. 6. Breast enlargement in males. 7. Premature baldness. 8. Enlargement of the prostate gland. 9. Irregularity in menstruation. 10. Problem of depression and aggression. Athletes' responsibilities. Athletes have certain responsibilities when being tested. It is important that athletes know and understand their responsibilities. Under the World Anti-Doping Code, ignorance is no excuse. Remain within direct observation of the DCO or chaperone at all times from the point of notification by DCO or chaperone until the completion of the sample collection procedure. Produce appropriate identification. Comply with sample collection procedures. Report immediately for the test unless there is a valid reason for a delay. Under the terms of the WDSEF Anti-Doping Code and the World Anti-Doping Code, all athletes are required to assume certain obligations. In essence, all athletes must be knowledgeable of and comply with all anti-doping policies and rules applicable to them, namely the codes, the rules, the policies and regulations of WDSEF, their national federations and national doping organizations. Take responsibility, in the context of anti-doping, for what they ingest and use. All athletes are required to study carefully the document WDSEF anti-doping rules. It is the responsibility of an athlete not to use prohibited substances and method. Side effects of prohibited substances. There are many side effects of prohibited substances. The side effects are like dehydration and decreased circulation, complications like stroke, cardiac arrhythmias, psychosis, and even death, increased heart rate and blood pressure, dose related to respiratory depression, cardiac irregularities caused by electrolyte imbalance, can cause physical and psychological dependence leading to many problems associated with addiction and withdrawal, potential for kidney, liver dysfunction, premature baldness, severe facial and body acne, enlargement of the prostate gland. Ergogenic aids in doping in sports. Nutritional supplements which claim to have performance-enhancing effect are called ergogenic acid, for example. Nutritional supplement that improve fat metabolism and skeletal muscle. Doping control procedure. Drug testing has become an increasingly large part of both professional and amateur sports. An athlete can be called for drug testing at any time, in or out of competition. During competition, some sports only carry out drug testing on the winning team or top 3 competitors. Others test by random selection from all competitors. Any athlete that has entered a competition or has been named as a member of a team participating in a competition, at any level within the country or outside the country, is eligible for testing as part of national team anytime during anti-doping program. Out-of-competition testing. Out-of-competition doping controls are one of the most powerful means of deterrence in detecting the use of forbidden substances, doping. Efficient doping control systems and policies are designed to protect the integrity of the sport and to protect the clean athletes. Out-of-competition testing is limited to the top-ranked athletes only. The WDSEF Anti-Doping Commission, in close cooperation with WADA, established the guidelines for selection of athletes to be included in the IDSF International Registered Testing Pool and selects the athletes to be included. As a registered testing post is selected for national and international level athletes, 2 different level of pools are selected. For international level athletes by the International Sports Federation and for national level athletes by the NADA. The success of the out-of-competition testing depends directly on the quality of the information that the authorized bodies receive.